More than 1 in 7, that's the estimated number of American adults affected with kidney disease, according to the CDC, and most are undiagnosed. March is National Kidney Month, a crucial time dedicated to raising awareness about kidney health and chronic kidney disease. And Dr. Michael Wiederkehr of Dallas Nephrology Associates is here with what we all need to know. Good morning, and thanks for coming in. Appreciate it. So, just first of all, simple question, but why are your kidneys so important for your bodily functions?
Well, so when we think about our kidneys, we always think about going to the bathroom and, making urine, getting rid of fluid and waste. But beyond that, kidney is actually a very important endocrine organ. What that means is that they're like glands. They make hormones. The 3 important hormones that kidneys make, one is for the blood pressure, regulates your blood pressure. One, for example, is for the bones, to keep your bones healthy and strong. And then the other one that's important is for your red blood cells, to make sure you don't become anemic. So it's not just getting rid of fluid and waste, but also they're important endocrine organs.
Okay, so they're pretty important.
They're very important.
So what can someone do to help their kidneys? What are good practices?
So the most important thing that you can do is stay healthy yourself. What is good for your body overall is good for your kidneys as well. So exercise, good nutrition, enough sleep, less stress. And very importantly, if you have a medical condition like diabetes, make sure you take your medications and check your blood sugar, make sure it's in good control. If you have high blood pressure, make sure you take your blood pressure medications and monitor that at home as well. And also, what's important is a lot of people take supplements, over-the-counter supplements, some of them, many of them, and not all of them are kidney friendly. So make sure you tell your primary care physician, or maybe your kidney doctor if you see the kidney doctor, to review those supplements and make sure they're all safe.
Okay, that's a great piece of advice. So what are the most common causes of kidney disease?
So number 1 and 2 is diabetes and hypertension. So high blood pressure and diabetes are always the most important causes, but there are some other conditions that can do it. Anytime you have an inflammation in the kidney, it can be from an infection, it can be from a medication, for example. And also sometimes there's an inflammation because your immune system, your body, attacks the kidneys. One example would be lupus. And sometimes we see patients who have a genetic disease, something that gets passed down from their parents. For example, with African Americans, we know about the APOL1 gene mutation. Or sometimes people are born with multiple cysts, develop kidney cysts, and the cysts can destroy the kidneys over time.
So what are the common symptoms, and then what happens when kidneys fail?
Yeah, so kidneys are very sneaky. They typically don't hurt. And sometimes we have to convince people that, yes, you do have kidney disease. You may not believe me, but we know from tests that there's some kidney damage. And as you mentioned earlier, a lot of people, it's very common. In fact, it's estimated that more than 40 million Americans have kidney disease, and many of them are not aware of it. So sometimes you do get like maybe bloody urine or bubbly urine, frothy urine, but more commonly there's no symptoms. Now in the late stages of kidney disease, to the very late stages, you can get symptoms like fatigue, weakness, lethargy, ankle swelling, short of breath. You may not sleep well at night, you may nap during the day, itchy skin. So there's a lot of symptoms that kind of pop up late. But early on, there's really very few symptoms, if any.
Well, the good news is there are treatments now that are very good.
Yes, we have very good treatments, and I always tell people if your kidneys fail, the best treatment for your kidneys is a kidney transplant. This can be from a family member or from a friend that gives you a kidney transplant. And actually, just recently, it was in the news about xenotransplantation from a piglet to a human. That's very exciting. That's coming our way. But of course, some people are not eligible. They cannot get a kidney transplant, or they have to go on a wait list. And what we sometimes have to do is dialysis. Now, the good news about dialysis is that we have a lot more options, especially home dialysis. This has become much easier, much more practical. You can do it yourself, or you can have a partner help you with that. And also, let's not forget that if you're elderly and you may have a lot of other issues going on, you may decide not to do dialysis and let nature take its course. And if you decide to do that, we have experts that help you and guide you along the way.
Thank you so much for coming in. We really appreciate your time. If you want more information, Dallas Nephrology Associates has 32 area locations. You can call 214-358-2300 or 877-654-3639. You could also go to dneph.com.